Guillain Barre Syndrome treatment by homeopathy, explained in detail by Dr. Rohit Deshpande. Guillain Barre Syndrome, GBS, is a rare but potentially life-threatening neurological disorder that affects the peripheral nervous system. Named after the French physicians Georges Guillain and Jean-Alexandre Barre, who first described the syndrome in 1916, GBS is characterized by the body's immune system attacking its own nerves. This immune-mediated condition often starts with weakness and tingling in the extremities and can progress rapidly, leading to muscle weakness, paralysis, and, in severe cases, respiratory failure. The exact cause of Guillain-Barre syndrome remains unknown, but it is believed to be triggered by an aberrant immune response to a preceding infection. The most commonly associated infections include respiratory or gastrointestinal viral or bacterial infections, such as Campylobacter jejuni, Epstein-Barr virus, EBV, cytomegalovirus, CMV, and Zika virus. However, GBS can also occur following vaccinations, including the influenza vaccine or the swine flu vaccine. The syndrome is thought to involve molecular mimicry, where the immune system mistakenly identifies components of the peripheral nerves as foreign and mounts an attack. This immune response damages the myelin sheath, the protective covering of nerve fibers, and, in severe cases, may also affect the nerve's axons. While Guillain-Barre syndrome can affect individuals of any age, it is more common in adults and slightly more prevalent in males than females. Certain factors increase the risk of developing GBS, including a recent infection or vaccination, a history of GBS in the family, and being older than 50 years. The onset of Guillain-Barre syndrome is typically rapid, often occurring days to weeks after an infection. The most common initial symptoms include weakness and tingling sensations in the legs, which may then progress to the arms and upper body. The weakness can rapidly progress and lead to temporary paralysis in severe cases. Other common symptoms include muscle weakness, abnormal sensations, loss of reflexes, difficulty in coordination, facial paralysis, tachycardia, problems in bladder and bowel functions. Diagnosing Guillain-Barre syndrome requires a thorough evaluation of a patient's medical history, physical examination, and several tests to rule out other potential causes of similar symptoms. The physician will assess muscle strength, reflexes, and sensation. Additionally, the following diagnostic tests are commonly employed. Lumbar puncture, spinal tap. A sample of cerebrospinal fluid, CSF, is collected and analyzed for elevated protein levels, which is a characteristic finding in GBS. Electromyography, EMG. This test measures the electrical activity of the muscles and nerves, helping to confirm the presence of nerve damage and determine its extent. Nerve conduction studies, NCS. By measuring the speed and strength of electrical impulses traveling through the nerves, NCS can provide additional evidence of nerve damage. Blood tests. These tests may be conducted to check for specific antibodies associated with GBS or to identify any underlying infections. Homeopathic treatment has demonstrated remarkable effectiveness in the treatment of Guillain-Barre syndrome. Through its holistic approach, homeopathy addresses the underlying causes and imbalances that contribute to this debilitating neurological disorder. By carefully selecting remedies based on individualized symptoms and the principle of like cures like, homeopathy stimulates the body's innate healing abilities, promoting a faster recovery and reducing the severity of symptoms. The selection of homeopathic remedies for GBS should be based on individual symptoms, case analysis, and the principles of homeopathy. Here are some important homeopathic medicines. 1. Causticum is a commonly used homeopathic remedy for neurological conditions, including GBS. It is often indicated when there is weakness and paralysis of the limbs, with a tendency towards contractures or deformities. Patients who may benefit from causticum may experience difficulty in walking, loss of sensation, and trembling or trembling-like movements. The remedy is also known for its effect on the urinary system and may be indicated if bladder dysfunction is present. 2. Gelsemium is another important homeopathic remedy to consider for GBS. It is often indicated when there is extreme weakness and heaviness of the limbs, with a feeling of languor and exhaustion. Patients may experience trembling, lack of coordination, and muscle weakness. Gelsemium is also known for its effects on the nervous system and may help alleviate associated anxiety and restlessness. 3. Rus toxicodendron, derived from poison ivy, is a well-known remedy for conditions involving weakness and stiffness of the muscles and joints. In GBS, it may be helpful when there is paralysis or weakness that worsens with rest and improves with motion. Patients may experience aching pain, restlessness, and a desire to stretch or move. Rus toxicodendron can also address stiffness, numbness, and tingling sensations in the affected areas. 4. Plumbum metallicum, derived from lead, is a remedy often considered for neurological conditions. It may be indicated in GBS when there is muscle weakness, paralysis, and wasting of muscles. Patients may experience a feeling of tightness and constrictive pain in the affected limbs. Plumbum metallicum may also be beneficial for addressing issues with coordination, gait disturbances, and muscular atrophy. 5. Phosphorus is a homeopathic remedy known for its effects on the nervous system. It may be considered in GBS when there is weakness and paralysis of the limbs, along with sensory disturbances such as numbness and tingling. Patients may experience trembling-like movements, and a tendency to exhaustion. Phosphorus is also known for its effects on the respiratory system and may be beneficial if there are associated respiratory difficulties. Remember, these are just a few examples of homeopathic remedies that may be considered for GBS. Proper case analysis, individualization, and thorough understanding of the patient's symptoms and overall health are essential for effective homeopathic treatment. One of the key strengths of homeopathy is its focus on individualized treatment. Homeopathic practitioners take into account the unique symptoms and circumstances of each patient when prescribing remedies. In the case of GBS, this approach is particularly valuable as the condition presents differently in each individual. By considering the specific symptoms and constitutional makeup of the patient, homeopathy aims to stimulate the body's inherent ability to heal itself, addressing the root causes of the disease rather than merely alleviating symptoms. Homeopathic remedies are known for their ability to support and strengthen the immune system. GBS is believed to occur due to an autoimmune response, where the immune system mistakenly attacks the peripheral nerves. Homeopathic medicines work by stimulating the body's defense mechanisms, aiding in the restoration of the immune system's balance. By strengthening the immune response, homeopathy can potentially play a significant role in modulating the progression of GBS and facilitating a speedier recovery. The use of homeopathy in neurological conditions, including GBS, is gaining recognition for its potential benefits. Homeopathic remedies are selected based on their ability to address the specific symptoms experienced by GBS patients, such as muscle weakness, tingling sensations, and numbness. These remedies, derived from natural substances, are believed to interact with the body's energy and promote healing at a cellular level. While more research is needed to fully understand the mechanisms of action Anecdotal evidence and case studies suggest that homeopathy can help improve neurological function in GBS patients. A significant advantage of homeopathic treatment is its safety profile. Homeopathic remedies are highly diluted substances, minimizing the risk of adverse reactions and toxicity. This makes them suitable for all age groups, including children and the elderly, as well as individuals with compromised health. Unlike some conventional treatments, homeopathy offers a gentle and non-invasive approach with minimal side effects. This aspect is particularly important in GBS cases, where patients may already be experiencing weakness and vulnerability. There is a growing body of evidence suggesting its potential benefits. Numerous case reports and observational studies have documented positive outcomes in GBS patients treated with homeopathy. These reports highlight improvements in motor function, reduction in pain and discomfort, and overall faster recovery compared to conventional treatments alone. While further large-scale, controlled studies are needed, the existing evidence provides a solid foundation for considering homeopathy as a complementary or alternative therapy in GBS. Homeopathic treatment offers a promising approach in the management of Guillain Barre Syndrome. Its individualized approach, immune system support, and focus on strengthening neurological health make it an attractive option for patients seeking a holistic therapeutic approach. Thank you for watching this video. For more informative content, please like, share, and subscribe to Dr. Rohit Deshpande's YouTube channel.